we are in the home at a minimum of 5 hours a day, 3 days a week. A
Mhm.
minimum of 5 hours a day, 3 days a week, all the way to 24/7. So you could have one customer that comes to you and is 24/7 who potentially could be paying you $25,000 a month.
Welcome to the Tracer Podcast, your inside track to all things franchising. We provide essential resources for anyone in the franchising world. Let's get into it.
All right. Welcome to the Tracer Franchising Podcast. Today we have Marcos Moura from Amada Senior Care. It's a massive in-home senior care franchise, a lot of differentiators. I've been hoping to get you on the show for a while, so I appreciate you being here, Marcos.
Yeah, you bet, Joshua. Thanks for having us on. I appreciate it.
Yeah. And what's cool, I think, as well about having you here is that you're not just in franchise development, you're actually a co-owner, right? So there's like another element, I think, to the business when you have someone who has some skin in the game in the actual franchise as well.
Thanks, man. Yeah, listen, it's been an amazing experience to grow the franchise brand from our one location here in Orange County, California, back in 2008. If you remember, 2008 was the Great Recession, right? When the mortgage meltdown and the financial crisis happened. So we built Amada Senior Care here in 2008 up until 2012. And 2012 was when we actually started franchising. And now we're at about 280 locations throughout the country, and it's been an amazing ride.
That's awesome. Yeah. And is that 280 territories?
Yeah, 180 territories. So we have a lot of franchise partners that own two, three, or four territories. It's about 100 or 120 entrepreneurs that have joined us since 2012.
Wow. So yeah, it's a lot of multi-unit ownership here. Uh,
Yeah, yeah, and usually that happens along the way. So I think in a service brand, it's interesting for you to get into a service brand, do really well in a territory, get your feet under you and understand the business, and then expand to other markets as well. And so rarely do we really do it where an entrepreneur comes in and acquires Southern California. Usually they acquire a market, develop it, and then they'll acquire more markets as they go. So it's a cool testament that we've had so many entrepreneurs acquire more markets after they've come in and acquired their first one. It's like if a customer comes in and eats the meal and then comes back, you're like, hey, we did something right. So it's really cool to see our franchise partners grow into additional territories.
Yeah, yeah, very cool. Okay. And so let's talk a little bit about the franchise itself. So I gave just a cursory, intro, but a lot of times I say home care, people have no idea what it is. So what does
Yeah.
Amada actually do?
Yeah. So here's a great way to look at it. So there's two worlds that I try to explain to people. So when you hear the word home health, right? A lot of people think that home health and home care are the same thing. They're not. So home health, what you need to think about is when a nurse or a therapist or a physician or somebody medical comes to your house. And when they come to your house, they're going to do wound care, or therapy, or shots, anything that you need a medical degree or a nursing degree to be able to do. That is home health. Strangely enough, that's not what we do. Now you got to think about home care. What is home care? Home care is having somebody non-medical come to your house. This is somebody that you and I could be a caregiver tonight. This is somebody who's going to come to your house and help you dress and bathe and go to the bathroom and eat, throw the laundry in, clean up the house around you. It just provide companionship. That is home care. And that is really what we do. And so many times when we're talking to folks that are interested in Amada, they're like, wait, I thought you send nurses. No, we don't send nurses. Our caregivers are at most certified nurses aides, which is something you get from a community college. And a lot of times they don't even have a certification at all. Like I said, you and I could be caregivers tonight, go and take care of somebody. We'll receive specialized training, but our business is non-medical care in the senior's home. At least that's business number one. We have two other businesses that we've added since we started franchising, but that, yeah, home care is over 95% of our revenues today.
Awesome. Awesome. And so home care, like you said, bathing, toileting, feeding, general health. And so this is things that people don't really think about, right? So like
Mhm.
what percent of the population, what percent of people over whatever age actually need this?
Everybody. I don't know if it's everybody, but here's the thing. It's about duration. So if you live long enough, you're going to need care. It's just how much care and for how long. That's what most people don't really understand is if you're, my grandma died in 97. She had three caregivers total. She had one caregiver during the day, one caregiver at night, and one weekend caregiver, which was amazing. It was amazing that we were able to provide that for her. And she needed those caregivers all the way until the day that she passed away. It might be that you only need a caregiver for a week or for a day or for a month or 6 months or 10 years like my grandma did. But my belief is if you live long enough, you're going to need a caregiver. So the numbers are just astounding. Here's the other thing about caregiving. I have a friend of mine that owns a pool franchise here in Orange County. Does phenomenally well. Like the dude he's crushing it. And I was talking to him. He said, "Well, one of the issues that I have is that there's only so many homes that are being built in Orange County. Like, actually, there's no more homes being built in Orange County, really, especially in South County where we are. You have the ocean, you have the mountains, you have the base, a military base." So he said, they're not creating any more homes. So my inventory of homes that are going to need pools is less and less every day. And when I think about that is in home care, think about an inventory that is more and more every single day. So everyone who needs caregiving today is waking up today, and there's millions and millions of people going, "Oh my gosh, I need a caregiver." That's today's inventory. Millions and millions of people that just had this realization that mom or dad or I need or my wife needs or my husband needs a caregiver. Well, tomorrow it's going to reset again. There will be a whole new set of millions and millions and millions of people who are going to wake up and say, "I need a caregiver." So there is no time in our history where somebody will just go, the inventory is over or the inventory is going to decrease. It only continues to increase every single day that we're alive. It's crazy.
Yeah. And so I think, if you take a step back and you're listening to this and you're like, I need to figure out what franchise to get, right? One
Mhm.
of the biggest things is the industry, right? I think, it was like Warren Buffett said that if a great entrepreneur and a terrible industry ever met, only the industry would keep their reputation intact, right?
That's
Um,
pretty good.
yeah. And so, having an industry that has these big tailwinds, because right, all these people are turning 65, but most 65-year-olds don't need home care. But in
Right.
10
That's
years,
not who we're
in
caring for
15
usually.
years, in 20 years, they're gonna need it. Right? So, as long as someone's gonna be owning this business, right? As long as we can project out in the future, their market's gonna get bigger, right? So that I think that's a big point. Um,
Yeah. And size also of the ticket. That's the other thing that most people don't understand about home care. So sometimes people say, "Well, Marcus, why are you guys not doing nursing care? Why not do dialysis? Why not do these medical things?" The issue with doing medical, by the way, I have friends that own home health companies we talked about in the beginning who send nurses and therapists. They're great. But think about when you have a nurse come to your home, that nurse is going to be at your house for maybe a half hour, maybe 45 minutes. Nurses don't come to your home and are there for 6 hours, 7 hours, 10 hours, right? We would bankrupt the government if we had nurses going to people's homes for that long. What's great about home care, most people don't understand this, is we're not in the home for an hour a day or 2 hours a day or even 3 hours a day. Some people think that home care is just crisscrossing the city and going to Miss Jones's house, seeing if she's doing okay, cooking a meal, and then leaving. And then going to Mr. Smith's house. And no, we are in the home at a minimum of 5 hours a day, 3 days a week. A
mhm.
minimum of 5 hours a day, 3 days a week, all the way to 24/7. So you could have one customer that comes to you and is 24/7, who potentially could be paying you $25,000 a month. One client could potentially pay you $25,000 a month. That is very normal. It's not unusual that that happens. So that's the other thing that I think entrepreneurs are confused about is they think that this is just a cursory, easy, just an hour here, an hour there. That is not going to be the case. The average ticket of home care is really, really high because the need is urgent, acute, and people need a lot of it.
Yeah. Yep. So it's a growing industry. It's could be potentially a very big ticket item. Before there's a couple questions now. They're like, well, how are they paying for this, right? So we're not going to get in that yet.
Yeah.
We're not done
Yeah.
with the business itself. So I think another thing that stands out about Amada, right, is when a person they have home care, they're likely as they get older, they're going to get worse. So they have, two options. Unfortunately, they could die, right? Or they could need to go into a full-term home. And most other franchises or businesses in general go, okay, well, it's been nice doing business with you. Good luck finding one, right? But you guys do something different with that, right?
We do. Okay, so we talked about the business number one is home care. Business number two is what we call placements, senior placements. That is the idea that you may meet with a family and you identified that they need 24/7 care. And you identified that in their case, it's going to come up to about $27,000 a month, not just with Amada, but with any reputable company throughout the country, doesn't matter. It's going to be $27,000. And for some families, that's just not going to be possible. And we weren't willing just to walk out of the home and say, "Wow, sorry, you can't afford us, good luck, hope you find." No, what we realize is when you're in the home of a senior, you have to leave them with all of their options and help them figure it out. So if they can't afford that, then the very next best thing to having one of our caregivers in their home is for the senior to go into an assisted living. Now, the term assisted living is a lot of people don't really understand what that means. An assisted living is a place where you get all of your non-medical needs met, meaning you go live at, let's say it's called Oak Glen Living. I don't think that exists, but that's a lot of times what they're called, Oak Glen Living. When you're at Oak Glen Living, all of your dressing, bathing, grooming, eating, entertainment, all of those needs are provided in a home. That home may have only 6 seniors living in that home, or it might be a community that has 100 seniors. It might be a community that costs $40,000 a month, or it could be a community that only costs $5,000 a month. What's great about these communities is that you can help a family find the right community, home, facility, whatever it is that they want to do. And when we do that business, we get paid a commission from the assisted living. So it's really cool because it's a free service for the family. And these assisted livings, they need us. They have a really hard time trying to find exactly the client that they want. So if you have a senior, for example, that is now 280 pounds, needs insulin shots because his fingers don't work that well anymore, needs help taking his medication. He doesn't remember taking his medication. Well, what I just gave you, those few stats I just gave you, there are very few assisted livings who will take that senior. Very few. So our specialty is we find out exactly what the family needs. We find the exact home that it fits dad's socialization needs and fits dad's financials, right? If dad can only afford $7,000 a month, then we need to find a place that will accommodate dad and fit his medical needs for $7,000 a month. So when we do this business, we get paid a commission from the assisted living. And what's cool is the commission is usually equal to first month's rent. So it's like being a realtor without having a real estate license. If you have a home that is $7,000 a month to live in, our commission could be $7,000. And the family pays us nothing. It's awesome. The placements, the placement business, we believe it doubled between 23 and 24. Our placement business doubled. That's crazy. And we're seeing it this year. It's increasing like crazy as well.
Yeah. Yeah. And I like that because I've looked at placement specific franchises and their revenue is like a fraction of any of the in-home care, right?
Sure.
And so the fact that this is just a bolt-on makes a lot more sense to me than making it my primary business, right? Okay. So, and the other thing I like about this is like you focus on one thing and build a business, right? And then you can move into these other things. And then the next one would be health, right? You guys can do home health if someone wants to get into it. Is that right?
We can, but we don't.
Okay.
What we have added is staffing services. So staffing services is really exciting because the hospitals, the skilled nursings, and the assisted livings, those all kind of mean different things. But let's just talk these medical places and non-medical places. All these places that the senior might be in, they also need caregivers. So the same caregivers that we're sending over to Miss Jones's house or Mr. Patel's house, they can also go and work at a hospital. So a lot of the people walking around in scrubs at the hospital, they're not nurses, they're not therapists, they're not physicians, they are caregivers. So the hospitals are coming to us and saying, Amada, I need more caregivers. I can't keep enough caregivers. Can you help me staff my hospital with your caregivers? We say, sure. And so we're able to staff those caregivers inside of the hospital. The hospital then pays us an override on their hourly rates. We started just with caregivers, but now some of our franchise partners are also doing it where they can staff nurses, therapists, phlebotomists, parking lot attendants, whatever the hospital or the skilled nursing or the assisted living needs. We can help them with medical staffing. So medical staffing is cool because it doesn't put us into the medical realm. See, a lot of people are confused about that. If I am providing medical staffing services to a hospital, I'm just a recruiter. I'm not a medical organization.
Mm-hmm.
I just found a nurse, went through the background checks, made sure the nurse qualified, made sure the nurse has all the qualifications the hospital needs. I then have the nurse go work at that hospital under the direction of that hospital. I'm just a recruiter. So we still stay out of that medical line, right? We don't want to go above into that medical line. So home care, business number one, placements number two, medical staffing number three. But our franchise partners, like you said, they get to decide. Some of our franchise partners only do home care. That's totally okay. It's all right.
Yeah. Yep. And that itself is another franchise, right? Like there's medical staffing franchises out
There are.
right?
Yeah.
So, like,
Yeah, that's right. That's
these are
right.
like three true businesses
Three
in
in one.
And I think what's nice, and a lot of these territory bound franchises, I hear people say, well, what happens if I, saturate my territory? Well, one, you're probably not gonna do that, right?
No.
But two, right, get another territory, right? And then like, oh, well, there's tons of other people in this franchise. There's only 2 open right now. What happens if I want to go beyond that? Start staffing, right?
Yeah. Yeah.
I don't know if we want to get numbers just yet or at all on this, but you can see in your FED how big some of these franchises are in just 2 or 3 territories, right? And they're not doing staffing. It's like 95% home health, right? So this is something else is exciting is like each of these businesses can be very big with what, within the territories that you're providing.
You're absolutely, listen, you got to remember that we've been here in Orange County since 2008. We still run Orange County. Now, Orange County is like 2.5 million people, I think. We are in a sliver of Orange County. We're like in less than a third of Orange County is where all of our clients are. And we've been here since 2008. We're one of the largest companies in Southern California. We do really well here. We've been here for a long time. We're like top 4 or 5 companies in Orange County, right? But there are areas of Orange County we still haven't hit. We still have places in Orange County that our salespeople haven't been to because there's so much business in this little tiny section of Orange County that we are in. And I'm not saying you're going to do this or anybody's going to do this, but you could virtually do, you could do $20 million in revenues in a relatively very small market if you just keep specializing and deepening your connections in that market. I'm not saying anybody's going to do that, but I'm saying that you don't need to have territories throughout all of California to have a company that big.
Yeah. Yeah. And again, that goes back to, like, I'm not going to do it here because public math, right? But if you say, at least 5 hours a day, 3 days a week, $45 an hour is what you'll probably charge, right? Something around there. Multiply it out. Like, it's not that many. If in your mind you would think, to do 1 million, 2 million, 20 million would be like 1,000, 2,000 people. I don't think it's that many.
No. Yeah. You don't need to care for a large percentage of the population to have a very successful company. And that's what a lot of people say. Well, nobody can afford 30 grand a month. Nobody could afford $25,000 a month. There's no way that the percent of the population that's ever going to afford your services is minuscule. But what you're not considering is when you are 90, this is a lot of folks that we're caring for. When you are 90 and everything in your life has led up to this time, this date, that you just found out you need a caregiver. Whatever, and this is not a caregiver to keep you just having fun. This is a caregiver that's going to keep you alive. That's going to make sure you don't fall, that you take your medication, that you can get out of bed, get into bed, that you can be dry and clean all day long, not be in a diaper for 8 hours or the dirty diaper. These are like life-saving things you need. And so what a lot of folks understand is whatever was set aside by that family that may have been an inheritance or whatever it is, the family starts realizing, well, it's either we spend the money taking care of dad, or what's the other option? And so families, what I love about this is families rally, families come together to make sure that dad has the best 6 months, a year, 10 years, even if it takes a lot of that financial well-being that they've been able to put aside. If the financial well-being is not there, that's why we also have the placement service, right? To help the family find an assisted living and be able to keep more of that cash. That's also an option.
Yeah. And so let's talk about payments, right? So you have the cash where the families are coming
Mhm.
together. Maybe he has equity in a home that he's owned for 50 years, done well in stocks, like whatever it is, right? So they're paying in cash. But there's other options, right? So and I think those options are actually growing in popularity. So could you kind of talk about the other options too?
Yeah. So if you start a home care company, you are not going to be billing Medicare. Medicare does not pay for what we do. I don't care if you're 97 and you're blind and you can't eat or drink or go to the bathroom by yourself. Medicare is not going to pay the bill. Now, what I've just done is I just removed the biggest payer in our country
Hmm.
is Medicare, right? And we all get it when we turn 65. Bill Gates and Trump and Elon Musk, they have Medicare. They all get it. We're all going to get it. But it is not going to pay for your caregiving. So when you meet with the family, they've just gone through a very shocking series of events. Number one, dad needs a caregiver. No American family goes, I know exactly what you mean. They go, what the heck is a caregiver? The next question the family asks is, can you give me a prescription, doctor, so that I can just go ahead and have Medicare pay for it? So now they just learn, no, there's no prescriptions for this. Medicare's not going to pay for this. A lot of the families in freaking chaos are going, what the heck am I going to do now? So what you're walking into is you need to be able to help the family find every single possible way that they can pay for this. Remember, it's going to be probably 10, 15, 20, $25,000. It's not going to be cheap. So the family really needs some kind of an advocate that's going to teach them what are the options. So the options are, it's either going to be cash. We just talked about that. It could be Medicaid. Now, Medicaid is only going to be if you're low income, low assets. If you have some money to your name, Medicaid is not going to pay. As everybody knows listening, Medicaid is if you're low income, low assets and you're over 65, you could qualify for Medicaid. So in states where Medicaid is great, we do Medicaid. In states where Medicaid pays poorly, we can't do Medicaid. And that's fine. So Medicaid is another payer. And then there's two other payers that are massive for us. The Veterans Administration. So thankfully, the VA is an amazing resource. Ever since, even going back to World War II, in every period of war, the government has put legislation that says we will pay for X amount of your care. And so, depending on what time of war you served and what your discharge was and what was happening at the time, it will tell you if you qualify for VA benefits. VA benefits make up now about 14% of our billing nationwide. 14% is us helping veterans. That can be in low income, high income, urban, rural, we don't care. And we're very, very serious about ensuring that the billions of dollars that are stuck in the VA get to the veteran. That's the problem. The money's there. It's just the veteran needs somebody to help them get that money out of the VA. And that's what we do. So we file the benefit on the behalf of the veteran to make sure that they get the money, no matter where they are. The last payer is long-term care insurance. These are insurances sold by Genworth, New York Life, MetLife, Bankers Life, and Casualty. These are the Cadillac plans out there. They pay us really, really well. So it's only four payers. Medicare, sorry, screw that up. Medicaid, cash, long-term care insurance, or VA. Those are the four payers. And Josh, our differentiation is that we're the only company, I believe, we're the only company that doesn't just sit there and go, you need a caregiver, or, oh, my caregiver is going to love you more than anyone has ever loved. That's fine. But we're the only company that's really going to advocate and figure out how are they going to pay for this. And we help them file the claims. We help them get the money. Um, that's really what's needed throughout the country is that advocacy is so important.
Yeah. Yeah. Because I mean, what if what if they qualified for something and the kids didn't know, right? Then what? Right. So I
That's
think, yeah,
that's almost always what happens.
yeah,
They
that's
qualify for
crazy.
something, the kids have no idea.
Yeah. Yeah. So that's a huge benefit that you guys are, you're helping people for sure.
Yeah.
Um, okay. So now we know it's a good industry, right? There's lots of people out there who need it. You can make good money doing it. Um, but now there's two, in my mind, there's two major factors to being able to run the business effectively: bringing in customers or clients, right? And hiring the caregivers to actually take care of them,
Yeah.
and make sure that they're well trained and they're doing a good job, right? So could you talk about those two things?
Yeah. Okay. So let's talk about getting the customers. So getting the customers, what we know, we've been doing this for a long time. Nationwide, 80% of our business comes from referral sources. 20% of our business comes from Google pay per click, lead generation, ads, and that kind of stuff. That's an 80-20 rule. What does that tell you? If you want to be a successful entrepreneur in home care, you better be very good at getting referral sources to respond to you. Who are the referral sources? This is your local hospital, your local skilled nursing facility, your local assisted living. It also is financial planners, elder care attorneys, insurance agents, fiduciaries, reverse mortgage people. This means a nurse called us and said, hey, I'm discharging the Jones family today. They're going home. And I know Mr. Jones needs a caregiver. Get in here. We go to the hospital, we sit down with the family. Now, the way that we were able to get that nurse to respond to us is I went to that nurse and I explained to that nurse what our advocacy is. I told that nurse, listen, nurse, there's about 10% of everybody who're discharging, they're veterans. They're veterans and they need our help. When you call Amada for your veterans, we will make sure that we file the claim on their behalf, that we get the money they deserve out of the VA. And you know what, nurse? If you don't work with Amada, chances are that veteran is going to go try to get the money out of the VA and they're going to get denied. They're going to not know how to file it. They're going to get the runaround. We're not going to allow that to happen. So, nurse, start sending me all of your veterans. So that's one of the ways that we're getting that referral source to respond to me. So we have very, very specific ways that we show our franchise partners how to infiltrate these referral sources in their local market, not far flung. They don't have to go to like the next town, in their own town, how to go and get these referral sources to respond to them. And we're really, really good at doing that. Now, 20% of the business is going to be Google pay per click, and we've got that all dialed in. So the right entrepreneur with us is going to be the kind that will follow our model and will build a team that's going to go out and build those relationships of trust with those ideal referral sources that are going to refer business over to them.
Awesome.
That's how we get the business.
So if I Google right now, home care in Denver, right? There'd
Mhm.
probably be 20, 30 people that pop up, right?
Yeah, yeah.
I'm going to start a brand new business. How do I go to these referral sources and convince them to use me? Or are a lot of these referral sources not even being talked to by these other guys?
A lot of them are not being talked to other folks, but this is so crazy and so simple. Most home care companies, when they walk into a hospital, and let's say that what I just said there is kind of crazy because walking into a hospital is not easy. Like, Josh, if I told you, hey, here's the franchise, go walk into that hospital and get the business, what would you do? Where would you go? Who would you do? Would you know what to do?
I'd have no clue. I'd have no
You'd have
clue.
no clue. You're going to get kicked out of the hospital. Are you going to show up in a suit and they'd be like, what are you doing here? Are you a patient? Are you sick? So, such a specific art that we teach our franchise partners of how to go and infiltrate these referral sources. But I'll tell you this, most of our competitors, when they go to the hospital, And let's say they get 5 minutes of time with the head of case management. Case management at the hospital is the entity in the hospital that's sending people home, right? They wake up in the morning when they get there and they got to discharge 100 people. It's going to be madness, right? They got to get 100 people to pack their bags and get out. Right? It's done. You cannot stay in the hospital. And now in our country, if you're not dying, you got to get the heck out of the hospital.
Yeah.
So they've got a really difficult job. So imagine that you are the case manager and somebody comes in and says, listen, the reason you should refer to me is because my caregivers love more than anyone has ever loved. My caregivers are you're going to die when you see my caregivers. They are so sweet. And here's the problem, Josh, is there's no such thing as a company that has a monopoly on loving caregivers. I would never look you in the face and say, the reason you should go with Amada is my caregivers love more than anyone. No, we are hiring some of the same caregivers our competition is hiring. The difference is when we speak to our referral sources, it's, hey, case management, like I said, 14% of your discharges have long-term care insurance policies. These are policies that will pay for their care. You need to start working with Amada so we can identify those people who have long-term care insurance. And together we're going to discharge them or we're going to get them home safely. This that I'm explaining to you right now is not happening. I don't care if you're in Florida or Kansas or New York or Connecticut. What I just told you is not happening. Home care companies are not educating hospitals on how to improve their discharges, how to make sure that veteran goes home with a caregiver, how to make sure that Medicaid case goes home with a caregiver. But not only that, that over the weeks that follow, they're going to have the money to keep paying for this. That's what the advocacy that we create. So this is how we're going to infiltrate these referral sources. Same thing with financial planners, elder care attorneys, and insurance agents. Families are calling them up and saying, hey, Bob, you sold my dad an insurance policy or my annuity or your dad's financial planner. Bottom line is, I just found out I got to come up with $30,000 a month to take care of dad. What the heck do I do now? That's who you're going to call. Dad doesn't know anymore. You got to call that professional. Those professionals are gold mines for us. But we show our franchise partners exactly how to build those relationships of trust and build their businesses.
Awesome. Okay. I mean, that sounds pretty solid, right? I think a lot of people I don't think appreciate like how much hospitals don't know, right? These guys are really good at the anatomy and how the body work, but they're not keeping up to date with insurance. They're not keeping up to date with home care.
It's
just
not part of their checklist.
Yeah.
Do you know in the hospital, when you're being discharged, they may say, are you a veteran? To high five you for serving our country. But it's not in a hospital or skilled nursing. It's not their job to say, wait, you're a veteran? Did you know that the VA could pay for your care while you're... No. They don't have the time to do that. So there's so many missed opportunities that we're able to come in, and a lot of the education we do for the hospital is we're teaching them what the VA pays for. And every single time we do these classes to the case management team and the nurses and the social workers, they're like, what? The VA pays for that? I had no idea. Because most hospitals are not VA hospitals.
Yeah.
They don't know. They don't know. So we really believe that, our mission is we don't want another veteran to pass away, commit suicide, live in horrible conditions, because they don't have to. There's no reason our veterans should be doing that. There's billions of dollars at the VA set aside to help them. A company just has to get in there and organize the transition of that money to that veteran. That's our mission. Yep. That's what we're doing.
Very cool. Okay. So, you guys have a playbook to go out, and as long as someone's following it, right, they're getting these referrals. Well, they need caregivers, right? So how do you train them? How do you help them to find and grow their book of caregivers?
Yeah. So it's interesting because caregivers they actually are the business. It's funny because, and I get folks, some folks are like, well, am I ever going to get the business? I'm like, yeah, dude, you are. But then, will I ever hire a caregiver? Okay, let's talk about that. Because your your product is your caregivers. So if you had a manufacturing plant that made, I don't know, if you had a coffee roasting company and you had to like roast coffee, every day you're going to have coffee in these conveyor belts and you got to keep doing it. You got to keep ordering. You got to keep doing it. Right. Well, our product is amazing caregivers that are trained and do a very good job. And so I have to every day work on my conveyor belt of hiring those caregivers. And and um and so it's a since 2008 that we've been here in Orange County, there's rarely been a week that's gone by that we haven't hired a caregiver. Now think about that for a second. Since 2008, there's not been a week that's gone by that we haven't hired at least one caregiver. So what we teach you is you're always, always, always hiring caregivers. And so there's a hiring piece that we're going to teach you how to do, and then there's a retention piece that we're going to teach you how to do as well. The best home care companies are the companies that know how to retain their caregivers, because you can't hire yourself out of a retaining issue. Does that make sense? Like if you're not retaining your caregivers, you just can't go, I'll just hire more.
Yeah.
You
It's like
got
in
to
a
retain
bucket
your
with a hole in
caregivers.
it. You'll never fill it.
You'll never fill it.
Yeah.
And retaining caregivers is really interesting. There's a study done by My CNA Jobs. My CNA Jobs is like the Indeed of caregivers. They specialize in caregiver recruiting. And they do this report on caregivers, and every year they ask the caregivers, it's hundreds and hundreds of caregivers, I don't know how many, but they do a poll and they say, what's most important to you? Rank it in order of importance. And it says respect, hours, pay, flexibility, all these things. What do you think is the number one thing caregivers put as the number one thing that they value the most out of the employer?
I would guess that they have a steady schedule that they can rely on.
It's respect.
All right.
Respect. They want to be treated well.
They don't get treated
And the
well?
reason that, what's that?
Who's that's so surprising. Who's disrespecting them?
So in an industry where the vast majority of your employees are earning anywhere between $19 to $25 an hour, it's rampant that companies don't treat them very well.
Wow.
It's just the way it goes. A lot of companies just are not very good at treating their caregivers. And yet, if you think about what you're really building and what your net worth would be someday in this business, let's say you become an Amada franchise partner. Let's say you just start your own home care company. Let me tell you right now, and you better listen, that your net worth, your value someday, if you go to sell it, if you go to retire, if you want to leave it to the kids, will not be your clients. It will be how you treat your caregivers and how your caregivers feel about working for your company. So our franchise partner, Ken, who's in Colorado Springs, he has every day that he's driving, he has the staff connect him with one caregiver. So he drives to appointments and he calls the caregiver. And he says many times the caregiver cries because they're like, first, why are you calling me? Am I in trouble? It's like, no, I just want to see, how are you doing? How's it going? I haven't seen you in a while. And he has notes on their children and what their activities are and what they're doing. And he calls them and he speaks to them. It's very simple things like that. Or when a caregiver calls and says, I know I've only got 5 minutes left for I have to be able to shift in 5 minutes and my car broke down. There's two different type of companies. One company says, you dirty rat, like you start yelling at this person. The other company says, how can I help you? I got it. Don't worry. I will get another shift. I'll figure it out. Let's focus on your issue. How can I help you? And I know that might be counterintuitive to an employer to be that forgiving and that understanding. But when you realize that your net worth is your caregivers, not your clients, it's your caregivers, and you start realizing that you need to do anything that it takes for you to help your caregivers and enrich their lives. That's really what the business is all about. And if you do that, you're gonna retain those caregivers. Now, there's counseling involved. If you have a caregiver that's not able to keep those shifts and there's always issues going on, well, maybe I need to have that caregiver work different shifts. I need to give them different opportunities. There's ways for us to do that. But isn't it crazy that respect is the number one thing they say that they want to have in a shift, in a job?
Yeah.
It's a huge problem.
Yeah. So, if you're willing to be a good boss And actually, you say that, and I've um some of my siblings who had like Dunkin' Donut jobs or whatever jobs in college, um, they kind of said the same thing, and it's like these guys are skimping them, but it's like you need people to work for you. Yeah, it just never made sense. Especially guys coming from the military, it's like that's the number one thing. You don't treat your dudes bad. Like you just don't do that.
Treat
Uh,
treat me well. They're gonna do a very difficult job when they're in the home anyway. And if they love working for your company, it will be an extension of that to the family. The family is going to feel that pride and that love and appreciation they have for you. And then so I'm not, I don't want to trivialize this. It's not an easy thing to do. Um, your recruiting needs to be top notch.
mhm.
Like you can't bring out the weak sauce of, if you're a crappy recruiter, you're not gonna like this business. So you got to follow our model and you got to be a really good recruiter. You got to pay a lot of attention to that. And it's not that simple. I'd say it's not complicated, but you need to do it every single day. And if you do, then, you can build an amazing organization.
So let's talk about who is a good fit, right? You guys have seen over 100 franchisees. I'm sure you've seen some just absolutely blow it up. You've seen some struggle. Who's a good fit for Amada?
So one thing that we talk about in our values is that we are confidently humble, which seems like an oxymoron, right? But a confidently humble entrepreneur is one that when they go into a hospital and they've got, 2 dozen donuts, Amada stickers on it, and they show up there and they leave something and they see the case management team is busy and they show up and the case manager looks in there and says, I don't have time for you. Get out of here. There's the entrepreneur that has their ego just broken and they're going to cry in their car because they were just told to leave because they were some important hotshot somewhere. Like nobody speaks to me like that. There's that person, and then there's a person that has empathy for how busy that case manager is, for what they have going on, for the fact that that hospital is breathing down their necks. That entrepreneur has empathy and says, "Oh, I know you're so busy. Here, I'm going to leave you the donuts. I'm busy too. I got to go. I'll see you later." And you walk out. And you walk out happy. You walk out with empathy. You walk out going, I know I need to come back because the reason they're so busy with discharge and they're going so crazy is they don't have me there. I'm not there yet to help them to make sure that things calm down a little bit. And that goes into a lot of different topics of your tenacity and your ability to stay on target and keep going to these referral sources and keep building your business and not fall apart in the car crying because, somebody wasn't nice to you. So those are the things that really make a great entrepreneur for us. The other thing is somebody that is really going to enjoy being a large employer in their market, in their community. We talked about the caregiving side, right? These are again folks that you're going to be paying $19 to $25 an hour. They can have a lot of things going on in their lives, and our franchise partners often when we speak to them, they tell me stories about, oh, it was so cool the other day, and I was able to do XYZ for this caregiver. Right? I have this great relationship. They really enjoy that aspect. Now, if you don't enjoy the recruiting and the retention and speaking to your employees, you can hire somebody else who is better at that. But I think it's probably a good idea for you to enjoy um, working with folks and administering them and improving their lives and developing them and coaching. I think is really an important aspect of it. Um, and I think the tenacity will always win in this business. If you're the kind of person that can join a gym and stay on target and do your push-ups and do your exercises, and you're not looking at a shiny object every 3 months and you want to do something different, then tenacity is going to every single time make you successful in home care, not just with Amada, because you have to keep doing it and doing it and doing it and doing it really well. And we can show you how to do it. We'll give you the playbook, but you got to tenaciously go and execute.
Awesome. And then, do you have any like specific backgrounds? Right, like you have a lot of um uh uh, uh hospital, like medical salespeople. Do you have a lot of veterans? Do you have a lot of like what are some of the big backgrounds that get attracted to Amada?
Yeah, that's been a cool lesson for me that we started out, we just assumed, we said, well, listen, who knows hospital and skilled nursing and that medical infrastructure really well? Who knows how to go in there and solicit? Well, there's a lot of folks that are in medical sales who know really well how to do that. I think you have somebody in your family that does medical sales, right?
Yep. My sister would
So
crush it for sure.
yeah, exactly. Like they know that infrastructure. But here's what we found. One of our most successful franchise partners, it's two buddies that were district managers with retail outlets, just retail, right?
Mm,
And they went on to open Amada Senior Care. Rob and Greg, they are in Illinois, and they do phenomenally well. They had never done healthcare, had never walked into a hospital before, but they follow the model. They have this servant mentality, and they're really good with their staff, really good with their employees, really good with their clients, and they built an amazing, amazing business. Um, we have another franchise partner here in San Diego, just south of us, who was a Qualcomm guy, engineer,
that's interesting.
and he's John Budhansing. He's come in and done amazing in southern San Diego County, not even close to healthcare. So over the last, what has it been, 13, 14 years, we've learned a lot that I don't know that your background, your job description is going to be a predictor of success. I don't believe that anymore. I've seen way too many examples of people that come from all walks of life who have been tenacious. But I'll tell you, if you're a jerk, then you shouldn't do this.
Yeah.
No, if you don't love people, if you don't love the caregivers, if you're doing this just for the money, then I don't know. Yeah, go do something else. Right? You've got to have a mission and a value and something else that drives you, and the money will come because of that.
Very cool. So it's yeah, and you guys have like an NFL player too, don't you?
We have several. Yeah, we have several. Oh, Tafa, who's one of our founders, and really the guy who started Amada Senior Care. He played for the Bears.
Wow.
He was a center for the Bears. I once introduced Tafa as the center for the Chicago Cubs,
That
which just doesn't work, right? That's not.
yeah.
I don't follow football, and so. But yeah, so Tafa played for the Bears, and so we've got a really cool relationship with the NFL. We have Jonathan Burrow played. He's in San Diego. He's our franchise partner there. Amazing entrepreneur. He played for the Baltimore Ravens. Yeah, so we got a couple football players.
Yeah, so really just everything, right? Cool. Okay. And then can you talk about how people make the transition, right? Now, and this doesn't have to be Amada, but I know that's what your experience is in, but it's hard, it's scary, right? You go from I get paid every 2 weeks and I know what I'm getting paid and it's pretty good, to go build something new, right? You have support, but it's scary. So can you talk about how people kind of make that transition?
Yeah, so I think it's the whole idea that entrepreneurs make a decision and they go make the decision right. So once you make the decision of acquiring the franchise, then you better be prepared to spend the next couple of years making that decision right. And what that means is diving in and ensuring that the business works. I don't see this as something that entrepreneurs can just come in and sort of dabble in. And I think if you're starting a business, I think dabbling in starting a business and not dedicating the time to it is not a recipe for success.
Mhm.
So you really ought to decide that um, you're going to dedicate your time. Now, does it have to be full time? Maybe not, because maybe if you are not full time and you can hire the right person to run it with you, and you are there making sure that person is successful, I think that can work as well. So I've seen a lot of different things work. What are usually our pattern is that person, as soon as they are licensed, their office is ready, they're trained and they're ready to go, that they are then applying full-time efforts to build their business and make it right. That's usually what we see as the top model. I have seen, for example, we had a partnership in Colorado, which was three buddies. who stayed at their jobs, and they hired the right person. But between the three of them, they were like one full-time person. And they hired a full-time person as well, who was a family member, to run the business.
Mm-hmm.
They just recently sold their business, and they were able to do it. But it took them a little bit longer to build the kind of revenues they wanted to see. But they were okay with that. They were patient. They were okay with putting their money toward the person they hired to run it, not take a lot of business, not taking a lot of money out of the business. That's the other thing too. People say, "Oh, I want to do this part time, and I'm just going to invest in the business." But as soon as money shows up in the business, you start pulling it out, and then they starve that business. No, you got to feed that business to ensure that it's going to continue to be successful. If you are on a part time basis, you got to feed it. So we don't ever judge. If somebody's interested, we want to talk to them about their plan, but we will be brutally honest with them if we think their plan sucks. That's not going to work. But if there's a plan there, we're willing to listen to it.
Very cool. Okay. And then, if you're okay, are you willing to share some numbers from the item 19?
No, just reach out to us and get that. We have a really strong item 19. I think it's just better if because I like context. What I want you to do is, if I share, our average franchise partner does that, you're like, what? But I'd rather you go into our item 19 and look at the context, because I think we're one of the most disclosive franchises in the United States with our item 19. And I don't know if everybody would probably knows what item 19 is, but that's where we put our revenues of our franchise partners nationwide. And we put our low, we put our high, we put our average, we put our mid. We're very, very disclosive. And so I'd rather people go into the item 19 and look at it and get context.
There you go, guys. If you're interested, go you come talk to me. We'll make sure it's available, and then you'll get it
Yes.
through the research
Easy to
process.
get. Yeah, for sure. We'll get it
All
to
right.
you.
Okay. So moving on to the veteran piece, because I do work with a lot of vets, right? Probably listening to
Yeah.
this. Do you have veterans? Do you have several veterans in the system?
Yeah, we have it might be over 20 of our entrepreneurs. I mean, we have a lot of
Wow,
veterans
a
in
high
our
percent.
system. A
Yeah.
lot of veterans. Yeah.
Nice. Okay. Very cool. All right. And so let's look to the future, right? So
Yeah.
where do you see well, sorry, actually I do want to back up, but I want to ask something about the exits before we talk about the future.
Yeah. Yeah.
You mentioned guys have sold, right? There's been a lot of them, I think, who've sold. Do you see them mostly go to other franchisees? They have a big exit. Are you okay with private equity as a franchisee? Kind of like, what does that exit, look like for these guys?
Yeah, we'd be okay with private equity. They just have to abide by the franchise agreement. I mean, we want our franchise partners to have successful exits. And so as long as that person coming in passes our background check and they're the right entrepreneur, then we want our franchise partners to have success and exit. Exiting for us is never taboo. Like, we're super excited when a franchise partner reaches out and says, "Okay, I think I'm ready." And we want to provide them all the resources to be able to have a successful exit. So it has been a combination of current franchisees who have acquired them, and it's also been new entrepreneurs that have come in and put new blood and new efforts into those markets, and it's amazing. We have not had any franchise partners sell to PE, but I could see that happening in the future. Sure, we'd be totally open to that. I think what we are seeing is that since COVID, there's been some really good exits, because when you look at our franchise partners who got through COVID, if they were good franchise partners, a lot of them increased their business dramatically. So our COVID years, all the COVID years, if you consider what those years were, but all those years, we grew nationwide by double digits. Every single year, we grew by double digits.
That's amazing.
COVID is an accelerator for us. So now if you look at selling your business and you can show an entrepreneur, "Oh yeah, here's what happened to me during COVID." That's amazing, right? If a new entrepreneur sees that, they're like, "Dude, you not only survived through COVID, you thrived."
Yeah.
So we are seeing, not just in Amada, I think we're seeing some really successful exits in the home care space, because if it's a well-run company, COVID was a boom. It was great for home care.
Very cool. Okay. And now, like I said, looking forward, where do you see Amada in the next 5-10 years, right? What's the path forward for you guys?
Yeah, listen, we're super serious about our mission with veterans. um, we've had these epiphanies over the years that the VA is a wonderful institution. They really are amazing, but they're a bureaucracy. And so we want to continue furthering our efforts in the VA to ensure that no veteran passes away without the care that our legislation put in place for them to receive. Ever since World War II, there's amazing legislation that was put in there to protect our warriors, and we're very intent on that. So we're going to continue furthering our efforts in the VA. We're going to continue in our mission to ensure that everyone who bought a long-term care insurance policy in the United States gets that money. A lot of these companies out there on crusades against their policyholders, right? The insurance companies don't really want to pay out these claims. They're saying, no, 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 no. With Amada, we're going to get that money for those policyholders. It's our mission. And then what we really want to see is our current franchise partners. Really cool is we started franchising in 2012. What are we, 2025? That's insane. So it's fun to see our franchise partners in their 10th, 11th, 12th year. And more of them are reaching that. There's something amazing that happens as you run the business for 5 years, you become the expert. So our franchise partners are feeding amazing infrastructure into us. So our annual conference is coming up in 2 weeks. So we'll have, 300 people here in Orange County with us. And a lot of the annual conference is our franchise partners teaching what's happening in their markets. Different from a McDonald's or a Jersey Mike's, maybe. I like Jersey Mike's, I think is an amazing franchise, by the way. But I would assume Jersey Mike's is kind of cookie cutter in what they do nationwide. I think. Amada's not. Amada is very different. So our Jersey franchise partners will spend a lot of time teaching the nation on what they're doing that they figured out. So it's really cool. And I think that's going to continue to evolve. Yeah. Listen, we're super excited about the future. We still have a lot of growth, a ridiculous amount of growth ahead of us. There's another 800 markets we want to be in. So I can't wait, man. It's gonna be a really exciting next 5-10 years.
Very cool. Very cool. Awesome. So that's kind of closing out Amada, right? But now you have over the last, same since 2012, I'm sure learned a lot about franchising, right? So for like franchise lesson learns, what are common misconceptions when candidates come to you and they're talking to you about franchising that you'd want to kind of educate people about right now?
I think one thing that I've learned about franchising is we have a lot of franchise partners who focused on Amada for, let's say, 2, 3, 4, 5, 7 years. And I've seen this now, which is really cool. They deeply focused in one thing, executed it well. They shut off all the other stuff. They weren't doing Amada and this other thing and all these shiny objects. I think entrepreneurs can sometimes, as the grind gets harder, they're like, well, I'm going to go do this. I'm going to do that. I'm going to do that. But deeply focusing on one thing for that 2, 5, 7 years. What's happened then is Amada then becomes a launching pad for a lot of other things. What do I mean by that? I've seen entrepreneurs take Amada and now they've doubled down and they own 5, 6 territories in 2, 3 states, and they're building empires. I've also seen folks come in, build Amada, and now they're doing software or they're doing other businesses. That's totally cool. So what I think about a franchise is, if you're looking at a franchise, don't think that that's going to be the only thing you'll do for the rest of your life. When you pick the right franchise, all you're doing is let me just de-risk the next 2, 3, 5 years. Let me take a model that's going to ensure that I'm successful if I just execute. And after 3, 5 years, I've got this amazing base, this amazing business. I can be doing X amount of revenues. I have a team in place. What else can I go do? So you can dream about all these other things that you can do. And so if it's a painting company or a roofing or a tree cutting or Amada Senior Care, doesn't matter. Find something that's going to de-risk the next 5 years. Focus on it. Don't go buy stupid things or expensive cars, or just spend 5 years doing this one thing. And then what could the rest of your life can be all kinds of different things, right? Being a franchisee doesn't define you. It just gives you a launching pad. It's such an amazing opportunity.
Yeah, so amazing. That's really good advice. Well, I don't think I can follow that. So Marcos, thank you so much for being
Thanks,
here,
Dan.
sharing your wisdom. There's a lot more to Amada, right? There's things that we didn't get to cover. We're hit at the hour mark. So if people want to learn about the training, the support, the software, all of it is just tip top. Reach out to me. I'll check to make sure it's available in your territory. I'll make sure you're a good fit for it. If I can show you some other great options, and I have tons of software and checklists and all sorts of things to as you go through this research process. Help you find funding, CPAs, attorneys. That's what I'm here for, and it's all free because I'm kind of like a recruiter for people like Amada. So it's nothing, no cost to you, and if you get placed, you get the license, they grant it to you, then I get paid as a recruiter, right? So nothing out of your pocket. So love to
Josh,
do that for you.
what you do is so valuable. You know, having somebody like you going through all my experience, my values, my goals, my investment level, and having somebody work through all of that to find the ideal franchise, that is unbelievably valuable. So when you have the right vehicle and the right driver, that's when it's amazing, right? And that's what you're doing. You're putting people in the right vehicle, and you don't even charge them. It's
Yeah.
crazy.
Yeah, I've built over an 80 question quiz, right? So really digging into them and what's a good fit. And I've done, I think at this point I've read 200 or 300 hours worth of FTDs, videos, and all these other research, industry research. Uh, my goal is there's never gonna be somebody who calls me and tells me they failed, right? And if it is,
Yeah,
it's
that's
because
right.
they decided to just stop working on the business, right? Uh,
Yeah, yeah.
so I'm dedicated to that, and that's what Tracer Franchising is stands for.
I love it, man. You're doing God's work.
Well, I appreciate it.